Hello, and welcome to EuroCham's first ever webinar. Today we'll be discussing the healthcare sector in Cambodia. This marks the first of a planned series of webinars where we hope to tackle the most promising sectors in Cambodia's economy and highlight opportunities available to investors in each of those sectors. My name is Hesketh, and I'm the Business Services Manager at EuroCham Cambodia, and the goal of my department is to assist European companies explore and become established in the Cambodian market. Today, I will be joined by Jean-Gaetan Guillemaud, the General Manager of Zuellig Pharma. As you will hear later, Zuellig Pharma is one of the largest European distributors of medicine in Cambodia. This webinar will follow a three-part structure. First of all, I'll be providing an introduction to Cambodia today, its economy, and a top-level overview of the healthcare sector. And then following on, Jean-Gaetan will then go into detail about his experience as Zuellig Pharma in Cambodia and his own thoughts on the opportunities and challenges of Cambodia's healthcare sector today. Finally, we'll end with a Q&A session, and I'll ask you to leave those questions to the end of the presentation, but please feel free to add questions in the chat box as and when you feel the need to ask them. So, as an overview of EuroCham itself, EuroCham was founded in 2011, and with the support of the European Union ICI Plus grant, EuroCham today has over 20 employees and represents over 330 members, making it the largest Western business chamber in Cambodia. The only larger chambers operating in the country are that of China and Cambodia itself. So the activities of EuroCham are divided into four main pillars. Our services department, which I represent, supports EU businesses enter the Cambodian market via paid advisory services. Our advocacy function aims to understand the challenges faced by our 330 members across 10 sectoral committees. And in doing so, and in understanding those challenges, aims to build on that by advocating for policy changes that improve the ease of doing business for European companies in each of those sectors. Our outreach function aims to promote Cambodia as a trade and investment destination to the European Union. And finally, our membership department offers the traditional services of the Chamber of Commerce, including networking events and functions such as the EuroCham in Cambodia. So, our work has given us a broad understanding of the Cambodian market. But for those listeners unaware of Cambodia, Cambodia is a Buddhist country located in the center of the Greater Mekong sub-region. With an important access route to the sea, it's bordered by Thailand, Laos, Vietnam, and and is perhaps best known for its world-famous Angkor Wat complex. However, what many don't know is that Cambodia also has one of the fastest growing economies in the world. It has a highly stable political situation, and it also has a very young and increasingly educated population keen to drive Cambodia's future growth. Just a few key facts. Cambodia has a GDP of around 18.2 billion at the moment, and this is growing at a rate of over 7% per year since 2004. Its economy is largely driven by tourism, construction, agriculture, and the garment sector, particularly garment exports to the EU and the United States. It has a population of 15.76 million, 50% of whom are below the age of 25. And this population is mainly clustered around the major cities of Phnom Penh, Siem Reap, Siem Reapville, and Battambang. As demonstrated by this slide, Cambodia has also been enjoying a long period of macroeconomic stability. It has a low inflation rate, partly due to its dollarized economy. Dollars are currently exchanged at a rate of $1 for 4,100 Khmer Real on average, and this has remained somewhat steady over the last 10 years. Cambodia has been enjoying an increasing amount of forex reserves, which reached 11.7 billion in 2017. And also has a low budget deficit of around 0.9% of GDP in 2017, and a debt to GDP ratio of 32% at the end of 2016. So overall, it's a fast-growing economy with a young population and a stable political situation. As mentioned, it's one of the fastest-growing economies in the world. So how has that affected the healthcare sector? Well, overall, Cambodia's economic growth has had a profound effect on the overall health of the country. Life expectancy has increased nearly 20% to now around just short of 70 years old on average. Access to sanitation services has increased by 300% since the year 2000. And this has led to the Cambodian population increasing to around 16 million people in 2017. And as people live longer, the incidence of non-communicable diseases, such as cardiovascular diseases, diabetes, and cancer, has also increased. And this has contributed to the growth of supporting services such as medical insurance, although it remains small at the moment. So, while people are living longer and healthier lives, at the same time, the prevalence of many communicable diseases, such as HIV, malaria, and tuberculosis, has also decreased. Improvements in nutrition and sanitation have led to a decrease in the under-5 mortality rate. And so overall, Cambodian women are having fewer children, but healthier children. So how has this change in healthcare statistics affected government spending? Well, although the absolute amount that the government dedicates to public healthcare has increased, its share of total health expenditure, that's the amount of total health expenditure that the government provides, has remained around 20%. And around 60% of total health expenditure in the country remains as out-of-pocket expenditure. This 20% government share is currently one of the lowest in the ASEAN region. However, at the same time, during this period of rapid economic growth, the fact that government spending has remained around 7% remains impressive, and it currently remains around 7% of the national budget. Cambodia now faces the challenge of modernizing and upgrading its public health service, though, to match the growing demands of the population. The current government target is to expand the total health workforce to 36,000 workers by 2020. And that's from 25,000 in 2016. This is a huge undertaking that will require the cooperation of training institutes, universities, and government institutions. And at the same time, there will also need to be an increase in the healthcare facilities available to the public healthcare sector. So to demonstrate this, from 2008 to 2014, the number of public hospitals increased by over 20%, the number of provincial health centers increased by 15%, and the total number of hospital beds available to the public healthcare sector increased by 35%. However, improvements are still needed. These improvements have pushed Cambodia towards the ASEAN average for these figures, but it's still not quite there. However, while building the capacity of the public health sector, as well as trust in the services it can provide, remains a challenge. And although the public healthcare sector is improving, the vast amount of out-of-pocket expenditure has created opportunities for private healthcare providers in Cambodia. So on the graph on the left, you can see that nearly 2/3 of patients first sought treatment in a private health institution. And another interesting point is that those who could afford to travel abroad for healthcare often did. For example, to Thailand and Singapore for the very wealthy combined. This demand for private healthcare treatments has led to a 126% increase in the number of private sector institutions between 2009 and 2016. And as you can see on the table to the right, this is particularly focused on early childcare facilities. For example, the number of nursing care rooms increased by 347% between 2009 and 2015. Similarly, the number of pregnancy care rooms increased by 326%. And this has in part contributed to the dramatic reduction in under 5 mortality rate you saw in the previous slide. So, amongst others, this private sector investment has included hospitals from Japan and Singapore, as well as pharmaceutical and health equipment importers such as PKSH and Sanofi from Europe, as well as Zuellig Pharma, who you'll hear from later. So, what does this mean in terms of the government strategy for the healthcare sector? Well, to address some of the issues discussed, particularly related to the public healthcare workforce, a non-exhaustive list of Cambodia's health policies and plans, which you can see on this slide here, highlights 3 core areas. The first of these is workforce and infrastructure capacity of the public health sector. So first of all, this is the skills of the workforce available, and secondly, the efficiency and quality of services that public healthcare workers and facilities can provide. The second key theme that comes from Cambodia's healthcare strategies is modernization. So increased uptake of data management software, monitoring and evaluation systems, and improvements to health and patient data are all expected to be key drivers of improvement in the healthcare sector in the future. And this is a key driver of the Cambodian government policies. A key example of this would be the Health Information System Master Plan from 2016 to 2020, aiming to improve the data management capacity of Cambodia's public health sector. Finally, the third key driver of improvement in the public health sector will be strengthened legal frameworks. So this encompasses 2 main parts. The first is registration systems for companies, medicines, and devices needs improving and streamlining. And second, and an issue which we'll hear more about in the subsequent section, is the enhanced regulations to eradicate substandard and counterfeit medicine. This has been a key challenge of the EuroCham Health Sector Committee. So, to draw my own section to a close, I hope I've provided a brief overview of the Cambodian economy and its healthcare sector. I'll now pass on to Jean-Gaetan Guillemaud, who will share his on-the-ground experiences navigating the sector with Zuellig Pharmaceuticals.
Thank you very much, Tom. As Tom said, we are now going to deep dive a little bit more about certain specifics of the healthcare sector. I will be speaking today as the chairman of EuroCham, as the chairman of the healthcare committee under EuroCham, as well as GM of Zuellig Pharma Cambodia. The first element that is quite key in Cambodia is really the ratio of return on investment that we've seen over the last 4 years, which has increased dramatically. Cambodia is a fairly accessible market. As Tom said, it's dollarized. It's fairly open in terms of regulations. Foreign investment is actually more than welcome in Cambodia and very much facilitated by the regulatory environment. So the initial investment usually to start a business in Cambodia is quite reasonable. That, with the perspective of a 10% growth on the healthcare market and a fairly strong infrastructure on healthcare gives us a market which is, in our view, quite interesting. As Tom said, the sector is obviously split between public and private sector, and the private sector clearly represents the largest share of the Cambodia healthcare market, and is quite likely to keep gaining momentum over the next years. And that is especially true in terms of pharmaceuticals as well as medical devices, which are also, of course, in demand given the recent investment in hospitals and clinics that Tom touched on a few minutes ago. So what are the trends of this market? The number of hospitals has increased from 87 to 106 in the span of 6 years. That's a 22% increase in the number of healthcare facilities. The number of health centers, which are typically often located in provinces, has gone by 14%. The workforce itself has now gone over the 20,000 employee landmark and has increased by almost 15%. It's expected to reach 36,000 employees by 2020. When it comes to budget allocated to healthcare, the government budget is expected to keep growing as it has over the last years. But as we said, we see a stronger increase of the private sector, which is really the key driver of investment in Cambodia. The annual increase over the last 5 years has actually been quite impressive, with a growth which in average has exceeded 15% per annum in public or private sector investment. If we have to draw a quick SWOT analysis of the market, in terms of trends, we see an increasing government expenditure, and the very positive sign that we have seen on the market over the last couple of years is the launch of the National Social Security Fund, which is likely to become a platform of reimbursement for more and more people in Cambodia, therefore creating an additional influx of income into the healthcare sector. Healthcare standards are increasing steadily in Cambodia. The quality of healthcare as well as the quantity of facilities is increasing. We also see a strong development of expertise in certain areas that require quite a high level of technology, such as, for example, neurosurgery. And that drives a stronger demand for products and services. In terms of weaknesses, Cambodia is a relatively young economy, so the workforce is either quite young, is usually quite young, so there's therefore a little bit of skill and experience to be built. Obviously, in a developing market such as Cambodia, limitations in resources are to be taken into account. And the relatively young state of the Cambodian market also has an influence on healthcare-seeking behaviors. We see patients not always having the level of knowledge that we would see in other areas of the region. In terms of opportunities, we see in Cambodia a growth of health tourism and insurance. As Tom said, the insurance sector is still fairly young, but it's developing quite fast. Strong development of human resources is also visible on the market, as well as a growing middle class, which is really the driver of healthcare spending in Cambodia. Cambodia is a country where imported products are really very highly regarded. The perception of quality is very high, and people tend to purchase those products more often. And foreign expertise in treatment of non-communicable diseases is quite present, which helps drive better practices. Finally, in terms of threats, we see few issues regarding registration and renewal processes, which can take, for example, 2 years on pharmaceuticals. The strong presence of parallel trade in Cambodia is also a hindrance to the development of compliant practices. And finally, the rapid growth of the sector is challenging to the regulation, and sometimes the market grows a little bit faster than regulations around it. So if you're listening to this conference, you're in charge of Cambodia. You're very likely to also be in charge of Myanmar. And of course, when people look at Asian markets, they should prioritize. The first thing they look at is GDP and number of inhabitants. Cambodia and Myanmar have more or less the same GDP per capita, and Myanmar has 3 times as many inhabitants as Cambodia. Now, the two interesting elements that sometimes people don't look at are the fact that people in Cambodia spend more than twice as much on healthcare as people in Myanmar. And when they do, they tend to spend twice as much on multinational products. And that leads to a situation in which the Cambodia market is actually 95% the size of the Myanmar market when you're talking about multinational pharmaceuticals. The growth of the market is relatively impressive with the market which has been growing and is expected to keep growing above 11% over the next 5 years. Pharma market should reach $300 million by next year, and that growth is expected to keep maintaining over the next years. Now, within this market, which is already growing at a fairly high pace, what we see is that the market share accessible to multinational companies is also growing. More and more hospitals are private hospitals. Strong actions have been taken by the Ministry of Health against unlicensed practitioners or unlicensed pharmacies, and several crackdowns have been organized by MOH and Ministry of Interior against counterfeit and illegal imports. So within a fast-growing market, you also see a growing market share available to multinational companies. Again, if we look a little bit more at the SWOT of pharmaceutical sector in itself, so we're really talking about pharmaceuticals here. What we see is that the market is fairly easy to cover because most areas are relatively concentrated, and you can therefore very easily access a very large share of the population with a limited level of investment. The fact that the market is heavily reliant on imports is obviously an opportunity for foreign companies willing to invest in Cambodia. And the consumer perception that foreign-made pharmaceuticals are superior to domestic medicine also obviously benefits foreign drug makers. On the side of the opportunities, I will only touch on the point that I haven't covered before. But what we see is the fact that the governmental policy are widening to access more treatments is definitely good news. Is definitely good news for healthcare manufacturers. Finally, in terms of weaknesses, the relatively young stage of the healthcare system doesn't give us a lot of foreseeability on the potential impact of National Social Security Fund in Cambodia, and we don't know yet how impactful it's going to be to healthcare spending. The key element about the healthcare situation in Cambodia is the dramatic improvement that has happened over the last 20 years in terms of medical treatment. And we can see that, for example, through the very impressive decrease of under 5 mortality rate that Tom has already highlighted a little bit earlier. Now, the situation is still a situation in which we see quite a lot of risk factors that are directly driven by the limited economic development of the country, such as dietary risks, iron deficiencies, or childhood underweight issues. So there's clearly a very strong need for first need medicine in Cambodia. The second key element in Cambodia is the joint decrease in terms of prevalence of communicable diseases. That's something that Tom has mentioned, but also, unfortunately, the strong increase in non-communicable diseases in Cambodia, especially when it comes to diseases around diabetes, cardiovascular issues, heart issues, strokes, or chronic kidney issues. And that's typically driven by the rapid change in lifestyle in Cambodia, which unfortunately the population is a little bit unprepared for. 89% of the market is private in Cambodia. And as we said, this is only likely to grow over the next years. 95% of healthcare spending is therefore out of pocket was therefore out of pocket by 2016. When it comes to the contribution by channels, key channels in Cambodia are still the pharmacy channel, which actually represents more than half of the market, followed by a small but very quickly developing hospital channel, and finally a decreasing dispensing doctor channel. Now, if we touch quickly on the topic of registrations, registrations are under the Ministry of Health, and registration process is in itself split between a lab testing process, which is under the National Health Quality Control Center, and an administrative process, which is under the Department of Drug and Food. On pharmaceuticals, this process takes usually 15 to 18 months, sometimes 24 months, and your product will be registered for a period of 5 years. Food supplements benefit from a 3-year visa, medical devices from a 3-year visa too, whereas cosmetics benefit from a 2-year visa, but also a much shorter approval lead time of 1 to 2 months. One specificity of Cambodia is the fact that there is no price control imposed by MOH. One last specificity of Cambodia is the fact that the manufacturing site needs to be registered, but that registration can be handled in parallel to the one of the pharmaceutical. So that will now leave us to the Q&A session. If any of you have questions, we'll leave the floor to you.
Okay, we'll leave a few minutes just to have any questions. Please either raise your hand using electronically raise your hand using the tools on the web application, or feel free to type a question directly into the chat window. We'll leave around 30 seconds to ask a question, and then we'll close off for the day. Okay. Well, it looks like there's no questions for this particular session. If you do have some, and we haven't given you enough time to ask them now. Oh, okay. So we have one question. How big is the European presence in the healthcare sector in Cambodia? I guess it's probably best for you to answer.
All right. Thank you for this question. Well, there are several aspects to this question, I think. The first aspect is maybe the presence of manufacturers. On the manufacturer side, if you look at the 10 largest manufacturers that are also commercialized in Cambodia, you'll notice that 6 of them are actually European companies. So there is actually a very strong presence, and I think it's partially due to historical reasons of European companies in Cambodia. The second aspect outside of the purely commercial aspect is certainly the aspect of advocacy as well as the aspect of driving best practices in Cambodia. Several centers have been opened by French companies or by European companies, such as, for example, the Institut Pasteur, which plays a key role in driving better health practices in Cambodia. So the presence of NGOs, the presence of institutes such as the one of Institut Pasteur is quite noticeable in Cambodia. And when it comes to healthcare, it is also fairly obvious that through EuroCham, we see a very strong influence and a very high level of communication and dialogue happening between European institutions and, for instance, the Ministry of Health of Cambodia.
Okay, and are there any more questions in this presentation? If not, I think we'll close this session for now. Thank you everybody for attending. Thank you Jean-Gaetan for coming along to present. And we look forward to seeing you at the next EuroCham webinar. Thank you very much and goodbye.